I'm Dr. Agnes Maigallo. I'm a counseling psychologist. I have a PhD in counseling psychology, licensed by Kenya Counseling and Psychologist Board as a psychologist. I'm also a mental health practitioner. I have done an advanced diploma in mental health practice. I'm also trained in addiction treatment and addiction prevention. And recently I was accredited as a court mediator. My background is that of a teacher. I've been a transformation coach for quite a long time. And in my career life, I've looked at so many other issues, and I'm realizing mental health is everything that we need to sort for people to live successful life. Unfortunately, many people don't take mental health seriously. If, for example, you have an headache, you will go to hospital for physical, to be checked whether you are physically healthy. But when you feel you are stressed, most of us assume. And then we move to mental health crisis. But I don't want us today to look at the mental health crisis. I just want us to understand what is this mental health. So what is mental health? Like I said earlier, mental health is not it's not insanity. Mental health does not also mean being happy all the time. It's not about being happy all the time. Mental health is more than talking about mental health challenges, and this is where the rain is beating us. Because when you talk of mental health, people immediately shift and start thinking of depression, stress, anxiety, and bipolar. That's not what you're talking about when you're talking about mental health. It's an aspect of mental health, but that is not what mental health is. So according to the World Health Organization, we say mental health is a state of well-being where an individual realizes their own abilities, where individuals are able to cope with their own stress, where individuals are able to work productively and make contribution to their community. When you're doing that, we know you are mentally healthy. We know that you are mentally well. So, when I'm talking of mental health, I'm looking at it from the perspective of the World Health Organization. What is this? So, when we talk about mental health, what does it encompass? You look at how I think, how we feel, how we act, and how all that affects our ability to handle our daily life, how it affects our ability to connect with others. How do I feel? Is it affecting my life? Am I able to go to work? Am I able to manage my stress? Am I able to manage my problems? If we do that, then we say we are mentally well. How am I relating to my family, to my colleagues, to my friends? Then if you are doing it in a way that is satisfying to you and to the others, then we say you are mentally well. So when you're talking of mental health, we are looking at both the mental wellness and mental illnesses. What is the difference between mental wellness and mental illness? Because most people get confused. These are two different things. It is not the opposite ends of the same line. No. It does not mean on this column I'm mentally well and on that column I'm mentally ill. No. It's just like two parallel lines. Because when you look at mental illness, it ranges from having no symptoms completely to being diagnosed with symptoms like depression, anxiety, bipolar, panic disorders, all those which you look at, which are described by either ICD-11 or DSM-5. DSM-5 is the manual that helps us as mental health practitioners to to diagnose you with a mental illness. Now, mental wellness is different. It ranges from flourishing or thriving to struggling. So you can be thriving, you can be doing your things well, and then you get to a point where you can't do anything, or you are struggling to do to run your everyday life. So when you ask about the difference between mental illness, there's one thing you need to understand. You can have a mental disorder and you are mentally well. What I mean is that someone may be diagnosed with a mental disorder, but they are mentally well. What do I mean? Let's say, for example, someone has been diagnosed with bipolar mood disorder or major depressive disorder, what we call depression. And this person takes their medication well, goes for regular therapy, has good friends, is out, is enjoying their life, they are going to work. That person, much as they have a mental illness, that person is mentally well. It's like, for example, someone physically, someone who has HIV, she's taking her drugs, she's going to work, she's eating well, she's taking care of herself, she has a condition, but she's physically well. So you can be mentally ill, you can have a mental disorder, but you are mentally well. On the other side, someone may not have no mental illness or disorder. They have never been diagnosed with any mental health condition, but they are mentally unwell. Let's say, for example, someone who has not been diagnosed with anything, but they are very lonely, or they hate their job, or they hate their spouse, they hate their family. They are feeling empty. They have lost purpose in their life. Such a person is not mentally ill, but is mentally unwell, despite having any disorder. So, for the purpose of this food session, it is good to ask to understand that mental wellness is about how you are functioning. Mental illness is about the diagnosis you have. So you cannot go and say someone is mentally ill unless you've taken them for a mental health assessment. It's only a psychiatrist who can clearly tell us that this person is mentally ill. It is only a psychiatrist who can diagnose you with a mental illness. And that is why I always say it is not fair when we label others as mentally ill without a diagnosis. I may be stressed, yes. I may have mood fluctuations. That does not mean that person is mentally unwell. And remember, you cannot see wellness on an MRI. You cannot test it in the lab. Apana. It is how a person feels, how a person lives their life. So when you talk of mental illness, it's different from mental wellness, and they are completely different aspects. You can't just say someone is not mentally well because you can't say someone is mentally unwell because they have a mental illness. You can be mentally sick. You can have a diagnosis, but still you are okay. But you can go to a psychiatrist, be diagnosed with nothing. The psychiatrist is not able to tell you have a problem. They can't tell you, they can't define what you have. But when you look at it from a psychological point of view, we can assess you and tell you, you are unwell. You are unwell and you need help.